Thank you, Mary. I appreciate having the opportunity to spend this Tuesday evening with you and all of our participants. I want to thank our participants. I know some of you have probably been working all day, and the last thing you want to do is sit in front of your computer for another hour. So I do appreciate your time, and hopefully this will be worthwhile. My name is Scott Chyna. I am a clinical social worker. I'm not going to tell you how many years I've practiced social work, but we're way into the double digits. I've done a number of things throughout my career in terms of direct clinical practice. And at present, I am a professor in the School of Social Work at Boise State University. So a couple of things as we get started. First, a disclosure. I am receiving reimbursement from Empower Idaho for this presentation. There are no conflicts of interest related to this presentation. Some objectives. Hopefully, by the end of this session, you will learn basic physiological responses to internal and external stressors and recognize the correlation between physiological responses and emotional dysregulation. Hopefully, you will increase awareness of your own physiological responses to internal and external stressors. And lastly, hopefully you will learn specific techniques in managing physiological distress leading to emotional regulation. And before I get started formally, as Mary said, there is an opportunity for individuals to post questions in the chat. Please do so. I'm not going to monitor that chat. Mary and staff will. If there is a question that needs immediate answering or a concern, then Mary will interrupt and alert me to that. But I'm going to table questions until the end of the formal presentation. But please, if you have questions along the way, please add them to the chat. I begin with this quote from Carl Jaspers, which I think is pretty symbolic of the disconnect between biology and psychology for a long time. Carl Jaspers was a German-Swiss philosopher and psychiatrist. And, interestingly, he was alive during the beginning of the 20th century. So, over 100 years ago, and he himself recognized that there was a pretty large gulf between the study of biology and psychology. In my own training many years ago, unfortunately, I didn't receive much training as it relates to the body, any physiological training. With the advent of integrated behavioral health care, that tide has changed, I'm happy to say. We see the mind-body integration in what we call third wave therapies like mindfulness, cognitive behavioral therapy, acceptance and commitment therapy, and dialectical behavior therapy. And as a social work instructor, I'm happy to report that students now are getting the best of both. They are getting a solid foundation of not only psychology, but also neuroscience. So speaking of neuroscience, I am going to put my biology teacher cap on. I should say, science intimidates me. In high school, when I was in my biology classes, I didn't really like it. I think I might have been intimidated. So I will do my best. It's interesting because as I've gotten older, I've learned to really appreciate science. So growing older is a funny thing. I mean, I've also liked to go to bed at 9 o'clock. So who'd have thunk? Yeah, as you grow older, you change quite a bit. But I will attempt to explain in layperson's terms basic neuroscience and the relation between neuroscience and emotional well-being. We start with the central nervous system, which is the brain and spinal cord. The brain is an organ of nervous tissue. It's responsible for responses, sensation, movement, emotions, communication, thought processing, and memory. The spinal cord sends motor commands from the brain to the peripheral body and relays sensory information from the sensory organs. And the sensory organs are eyes, ears, nose, tongue, skin. They send that information to the brain. The peripheral nervous system is that part of the nervous system that is outside, that lies outside the brain and the spinal cord. So if you look at this illustration in pink, you see the brain and spinal cord, and then you see, a plethora of nerves in blue, and that's the peripheral nervous system. Part of the peripheral nervous system is the autonomic nervous system. And the autonomic nervous system regulates involuntary physiological processes. These include heart rate, blood pressure, respiration, digestion, sexual arousal. There are two divisions of the autonomic nervous system. The first is the sympathetic, which is commonly known as the fight or flight system. The second is the parasympathetic, which is known as the rest and digest system. The brain. Brain is pretty fascinating. In 1990s, Gabbard characterized that decade as the decade of the brain. And what we found was there was an emergence of advanced technology which allowed for less invasive study of the brain. And this included functional and magnetic resonance imaging, which essentially measures small changes in blood flow that occur with brain activity. This research allowed for an enhanced understanding of affect, and affect in this presentation means mood and feeling, and emotion. So an enhanced understanding of affect and emotion, encoding and retrieval of memory, brain development, and environment. Encoding essentially is those experiences and memories that are encoded or embedded in the brain. Some key concepts. At birth, the brain is incomplete. Its organization and complexity is dependent on relational experience and environmental inputs. So essentially, the external environment of the individual. Healthy brain development is contingent upon healthy environmental influences. So quality caregiving from a parent or a caretaker in infancy and early childhood. Affective, again, mood and feeling. Neuroscience hypothesizes that each person's past experiences with relationships, particularly in early development, become hardwired in neural networks and influence the quality of future relationships. So this is the underpinning of attachment theory. And as attachment theory has evolved, it's really taken neuroscience and examined the way the brain has impacted the early developmental brain has impacted relationships. Past experiences, good and bad, become encoded and potentially triggered in present moments. Again, encoded meaning embedded in the brain. Intense emotions activate the brain's limbic system, in particular the amygdala. And the limbic system, it's essentially a complex set of brain structures involved in emotion, motivation, memory, and behavior regulation. Responses such as fear increase stress hormones, so adrenaline, for example, which then involves an increased heart rate, blood pressure, and oxygen intake. Chronic activation of stress responses can contribute to adverse physical health outcomes. And we see that with the adverse childhood experiences study, which I'll talk about in a moment. So coming back to the limbic system. So the limbic system, or as I referenced earlier, the fight or flight response is activated when threat is encountered. So the amygdala sends a distress signal. The hypothalamus activates sympathetic nervous system by sending signals through the autonomic nerves to the adrenal glands. Those adrenal glands respond by pumping adrenaline into the bloodstream, which again results in rapid heart rate, pushing blood to the muscles, heart, and other vital organs. Again, pulse rate and blood pressure go up, breathing intensifies, extra oxygen is sent to the brain, increasing alertness. Our senses become sharper, sight, hearing, and they're all kind of at a level 10. What's interesting is that these changes happen so suddenly and so quickly that visual centers often don't have a chance to fully process what's happening. An example of this might be if one is in the path of an oncoming car, oftentimes there isn't a conscious decision to jump out of the way. The limbic system activates that response, that reflex. I'm going to go back to the fight or flight response. And so that's a pretty common, we've heard that a lot, I think, in just everyday language. It was first coined by an American physiologist by the name of William Bradford Cannon in 1915, when he first started studying animals in danger and then studied the responses of human beings in danger. So the initial flight or fight response was denoted. But then as we've moved forward in our research, we note that there are other responses. Those include the freeze response, which is just that. Someone might freeze in the face of danger. There's also the fawning response. And the fawning response is essentially one's ability to attempt to please or appease the needs of someone else instead of prioritizing their own well-being. And this is commonly seen in response to abusive situations, interpersonal abusive situations, interpersonal partner violence, for example. So there certainly is some underpinning. There's theoretical underpinning, and many of you have probably heard of Bessel van der Kolk. There's also an individual by the name of Gabor Mate, who have studied early exposure to that fractured caregiving or attachment, and which results in impaired self-regulation. As an aside, it's fascinating to me that Bessel's book, The Body Keeps the Score, which many of you have probably heard about or read, this book has been in the New York Times bestseller list, the top 10, for several years. I think I actually looked at it this Sunday on the list, and it's like 182 weeks. So clearly there is an appetite for learning more about the body-mind connection. And as another aside, I recently read an article that indicated Google searches have been tracking up as it relates to emotional dysregulation and the body's response. So, I'm not sure if that's good or bad news. I would hate to think that many people are struggling with dysregulation, but I'm going to look at it from a strengths-based perspective and say that people want to become educated about their own responses. In addition to van der Kolk and Mate, we have Stephen Porges, who has done some work related to the polyvagal response and polyvagal theory. And then we have the somatic marker hypothesis, which essentially is the notion that decision-making is influenced by biasing body signals. So, we may say things in our everyday vernacular like, I had a gut feeling, or I could feel it in my bones. And those feelings then lead to a decision that we might make about a situation. So the hypothesis is that our bodies actually give us information, which then allows us to make a decision. Some physiological responses to stress. What we know is that stress is an aspect of life. And according to the National Scientific Council on the Developing Child, there are 3 types of stress that a child may be faced with. And if we think about the developing brain and the concept of the blank slate that Aristotle talked about and B.F. Skinner talked about, remember that neuroscience looks at that brain in early development, and these types of stress may actually impact brain development. The first is positive stress, and this is the type of stress that a kid might feel when they're excited before a performance or an exam or trying something new. So a healthy sense of what I say fear. We all want our children to push themselves a little bit and expand, because that's when they can become a bit self-actualized. The second is tolerable stress. And this is stress experienced during a challenging time. And generally it goes away once the event that triggered the stress is over. So an example of this might be when a kid first starts kindergarten and it's their first time being separated from a caregiver or a parent. And so it might be stressful, but it's tolerable stress. And it's fleeting, because the more that the child goes to kindergarten, hopefully, then they will build some independence and not feel that separation anxiety. Another example of tolerable stress is when a pet dies, or when a relative on the periphery might die, like a grandparent. Toxic or traumatic stress is the type of stress that is chronic and it's unrelenting. And it's commonly what we see in those adverse childhood experiences. And speaking of those adverse childhood experiences, these are typically traumatic events that occur in childhood between the ages of 0 and 17. These include experiencing violence, abuse, or neglect, witnessing violence in the home or community, or living with a family member who becomes incarcerated. This study was commissioned, the ACEs study was commissioned in the mid-1990s through the Centers for Disease Control and the Kaiser Foundation. And it's been monumental in terms of how folks practice, how I practice, and has really lended itself to the notion of trauma-informed care. So the adverse childhood experiences, in one of the risks is a development of chronic diseases later in life. Chronic diseases, which are the leading causes of death, such as cancer, diabetes, heart disease, and suicide. So why all this focus on early development? I always go back to my evidence-based research. So evidence-based research enhances our understanding of the importance of nurture and the subsequent biological impact upon nature. So the old adage is, is one's demeanor related to nature or nurture? And it's a combination of the two, essentially. The past is important as it provides a framework. Childhood is a template. And for me as a clinician, when I assess, it's really important for me to get an accurate depiction of one's early developmental stages. What was caregiving like? Were essential needs being met? Once we understand one's childhood, or even our own childhood, I'm not even talking about if one is a clinician, if one just wants to understand themselves, it's important to maybe reflect on the things that one got in childhood that might not have been the healthiest. We can begin to consider gaps and protective factors. And this is important because I don't want to focus so much on the negative aspects of childhood. There are certainly aspects that are strengths-based, and even under the most horrific circumstances that a child might endure, it's important for us to assess those strengths that a child may have experienced in relationships outside of caregivers, those essential others that may have provided support. And this goes into the concept of resiliency. And there's a plethora of studies related to resiliency and kids who then turn into adults who don't have these long-term markers that the ACEs indicates. So it's important, again, to just realize that this is not a foregone conclusion that if someone experiences ACEs that they will suffer the consequences of emotional and physical impairment. And then finally, we can begin to understand our reactions and ourselves. And again, as a clinician, it helps me understand my client a little bit better, but personally, it also helps me understand myself a little bit better. And when I think about my own upbringing and patterns of attachment, it helps explain potentially my hot button issues. Increased arousal is a transdiagnostic feature, which essentially means that this is seen in a number of diagnoses, DSM diagnoses. They certainly are seen in trauma disorders. We see with post-traumatic stress disorder, there is a hypervigilance and certainly a somatic response to flashbacks, for example. We may see an increased arousal in anxiety disorders, so generalized anxiety or social anxiety. We see increased arousal in personality disorders, typically the cluster B, which includes borderline personality disorders. We see them in disruptive impulse control and conduct disorders like oppositional defiant disorder, intermittent explosive disorder, and depressive bipolar disorders and attention deficit disorder. Beyond increased arousal, just in general, when you consider mental illness, there's manifestations in other diagnoses beyond increased or other symptoms beyond increased arousal. So with depression, for example, we see that there may be some somatic aches or pains or increased fatigue. So there is a link. There is a link. As an aside, I want to talk a little bit about functional neurological disorder, and this doesn't necessarily relate to emotional dysregulation, which is the topic of tonight's discussion, but I thought it was important to include, and it really illustrates the mind-body connection. So functional neurological disorder is a formal DSM diagnosis. It used to be called conversion disorder. And the symptoms, the somatic symptoms, are typically related to an altered motor or sensory functioning. So those might include weakness or paralysis, tremors, seizures. There might also be some sensory symptom disturbance. There's an old term called hysterical blindness. And essentially, these conditions, these somatic conditions, are not rooted in anything pathophysiological, meaning there is no formal medical etiology. And the old term for this was it's psychosomatic, right? But it's a fascinating diagnosis. And again, it illustrates the power of the mind and the impact on the body. And I'll give a quick example of working with somebody with functional neurological disorder. I, many years ago, worked with an individual who was involved in a pretty serious car accident, and they were driving, and their spouse was in the passenger seat. The accident resulted in the spouse losing his arm. His arm was amputated due to injury. My client felt inordinate amounts of guilt, really struggled with the effect of this trauma. And shortly after this accident, she developed paralysis in her right arm, couldn't use her right arm for months. And medical tests were run up and down. And through therapy, we discovered that this was essentially a functional neurological disorder, and it was in response to the trauma of her partner's losing his arm and her feelings of guilt. So again, just a fascinating illustration related to the link between mind and body. Somatic responses to stress and arousal. These include headaches, nausea, shortness of breath, shakiness, stomach pain, sweating, chest pain, dizziness, muscle tension, increased heart rate. These are also symptoms of panic. These are the hallmarks of a panic disorder. Several studies have documented that panic disorder is the most common reason for seeking emergency treatment for non-cardiac chest pain. Let's talk a little bit about internal stressors and external stressors. So external stressors originate beyond, outside oneself. So that could be the death of a loved one, a job loss, a deadline, maybe speaking on in a presentation to a group of people that you don't know. Those are external stressors. Internal stressors are stressors that originate from within. So that might be a thought distortion, a thinking error, a resurfaced memory, again, which is symbolic of post-traumatic stress disorder. It might be negative beliefs about oneself or the world. So the external and the internal stressors can create the same somatic response. So I want to engage in a bit of an exercise with all of you. And I'd like for you to think in the last 2 weeks or last week, I want you to think about something that you found, an event that occurred that was disturbing. So it may be something like someone cut you off in traffic, or you had a disagreement with a spouse or a partner, or your adolescent son wouldn't clean his room, or you heard a news story that was upsetting. So I don't want you to pick anything. If we're going to level from 1 to 10, don't pick anything, off the charts, no more than a 4 or 5. So think of something that was upsetting in the last week or two, and I want you to focus on your body as you think about that memory. And I'll give about 30 seconds and we'll be silent, and then we'll reconvene in a moment. And if anyone feels comfortable sharing what they felt in their body in the chat, that would be great. And I can just kind of eyeball that really quickly. And I can tell you, I'm going to be a little honest with you about what I felt, what I noticed. So actually, I'm gonna float back a little bit to just before the start of this presentation. And before my presentation, before any presentation, even before a class that I teach, I get a little anxious, right? So I notice that my palms may sweat a little bit. My mouth gets a little dry. My heart rate might increase a little bit. So that's my body response. That's my physical response. And I'm really aware of that. And as I'm kind of perusing the chat right now, I hear tightness, pressure in chest. And I feel that sometimes too when I feel anxious or upset. Muscle tension. We see head throbbing, feels like my blood is running cold, facial numbness. Yeah, sometimes I feel stuff in my gut if it's, kind of uncomfortable. So yeah, so I mean, again, just keeping in mind, being aware that there's a connection between something disturbing, and that was just a memory that we pulled up, right? A mild memory. And we notice that there is a physiological change. So our body responds to stimulus. We know this, right? That was an internal stimulus. In this day and age of social media and TikTok self-diagnosing, one thing I want to impart upon you tonight is that our somatic responses, the way our body responds to stress, is normal. And in many times, it's a defense. It is a defense, actually. So it's a defense against threat. And that's a good thing, right? We want to make sure that we protect ourselves when we are faced with adversity. Somatic responses are normal, right? Oftentimes when I'm with a client, they may recount something upsetting. We may be talking about something upsetting. They may have a memory of something upsetting. And I notice that they may be breathing rapidly, or they may feel tense. And they'll say, I'm having a panic attack. And I'll gently redirect them and say, you're having a feeling, right? So we don't want to pathologize these normal everyday responses. And it's easy in our society, especially in this day and age, to numb ourselves to feelings, right? Like we're a society of distraction, right? So we're always on our phone. We're, we're looking at, we're scrolling, we maybe numb ourselves with food or alcohol or TV, and that's something that we commonly do, right? What we want to monitor is our body's response when it becomes, when there's an impairment related to our functioning, if it gets in the way of being able to function, or if it gets in the way of maybe doing our work, or if it gets in the way of our interpersonal relationships. Whenever there's an impairment due to that somatic response, that's when we need to maybe consider, okay, maybe we need to learn how to regulate these somatic responses. So we get into emotional dysregulation. Emotional dysregulation is essentially difficulty managing emotional responses. It's an inability to maintain emotional control. In clinical terms, it used to be called emotional lability. So there's a high affective, and again, affective meaning mood and feeling, rapid emotional rise time. So someone who's quick to anger, for example, and slow rates of return to that emotional baseline, that feeling of calmness. Potentially, there's some excessive reactivity to psychosocial cues, random, chaotic, or rapidly cycling fluctuation in mood and feeling. So that's the dysregulation piece, right? I mean, there are times when we all feel dysregulation, but if it's a pattern and if it happens in a number of situations and circumstances, that may be an indication that we may need to intervene accordingly. So there's some risk factors, and this again, if we think back on the neuroscience research that I touched upon a few slides back. So children who do not have access to sensitive caregivers or who do not feel safe in their environment are less likely to receive opportunities to learn constructive strategies of mood regulation. Failure, here's the attachment theory again. Failure to develop secure attachments with caregivers during early childhood has been associated with managing and making sense of emotions. And interestingly, children who report ACEs tend to exhibit dysregulation of the hypothalamic pituitary adrenal axis, the HPA axis. And this axis is associated with high emotional reactivity. So there's some brain changes going on when this happens. So common presentations of individuals who struggle with emotional dysregulation. These presentations include chronic depression or anxiety, irritability, overreactions, or conversely underreactions, kind of a dissociation, and thought rumination, so thinking about things over and over and over. The feeling states are unable to be controlled. I should say that, in my experience in working with individuals who really struggle with emotional dysregulation, there's a reduced quality of life. So there's an impairment in social, relational functioning, challenges in interpersonal relationships. And this makes sense, especially if, one has not had a template of essential caregiving and healthy others in their life early on. They may perceive relationships as being threatening, right? So interpersonal psychosocial interactions may be threatening. And research indicates that the orbitofrontal cortex, which controls emotions, impulse control, and social interactions, exhibited smaller gray matter volumes in physically healthy individuals that have problems regulating emotions. So interesting, the gray matter in the brain is reduced, or maybe it failed to develop. So if we look at a couple of approaches in working with folks, we see that and this is like a therapeutic approach, right? So we think of there's a top-down approach, which essentially is that people have the ability to reason in these moments of stress, and they use past experiences as a foundation to make decisions. There's logic, and we use our logic to fill in the blanks, right? So there may be stimulus, an individual thinks about the stimulus, and then there's something felt based on thoughts about the stimulus. So it's kind of it's a linear process, right? It's kind of slower. And this is something that might be helpful to, this is the heart of cognitive behavioral therapy, essentially. And cognitive behavioral therapy, especially mindful cognitive behavioral therapy, is really helpful for folks who respond to this top-down approach. And as an aside, if anyone is interested in learning more about mindful cognitive behavioral therapy, John Kabat-Zinn, K-A-B-A-T, Zinn, is the individual, is a medical doctor who essentially has written prolifically about mindfulness-based cognitive therapy. If we look at the bottom-up approach, we recognize that the threat is experienced and there's a physical response immediately. So there potentially isn't that time to really be logical or consider past experience, which informs the decisions moving forward. So with folks that experience emotional dysregulation, a stimulus occurs and then emotion is sparked immediately. There's no middle ground. There's no thinking, pausing. The emotion is sparked. So with that, we know that body sensations or feelings are the first to occur because a threat is being experienced. And the sensory, motor, and survival functions of the brain, the lower parts, this is why we're saying bottom up, may respond in either fight or flight, freeze, or fawn. So teaching regulation or learning regulation requires our awareness of our own physical responses and lowering arousal, focusing on muscle contraction. We have to feel safe. Our clients have to feel safe in order to then consider the top-down approach, right? So this is why we say that, sometimes with folks who are really dysregulated, that the basic, most foundational thing is to teach emotional regulation skills. That's the first thing. The good news is that the brain is pretty malleable, and this is known as neuroplasticity. So it's essentially the ability of the nervous system to change its activity in response to internal, external stimuli by reorganizing its structure, right? And there we go again with mindfulness-based stress reduction. Longitudinal, so repeated studies, promote the theory that this intervention can actually increase gray matter concentration in the hippocampus, and thereby increasing one's ability to regulate their emotions. So this is really good news, right? Like, we can learn skills and we can teach skills that essentially may change the brain's structure. I will say, full disclosure, that it's easier to work with younger clients because children, adolescents, their brains are a little bit more malleable. But we're not going to rule out the fact that adults at any age can also learn these skills and potentially increase their gray matter. And in fact, research has demonstrated that this is the case. Okay, let's get on to some techniques. So the first, for those who struggle with emotional regulation, the first is to slow down. And maybe some of you remember when you learned about what to do in a fire, that stop, drop, and roll. In these situations, potentially we could consider stop, retreat, and scan. So the first is to stop, discontinue engagement from the stimulus or the trigger. Now, sometimes that's not realistic. And if that's the case, then what I always say is, maybe we stop speaking in those situations. Maybe we do a little bit of retreating within ourselves if we can't physically walk away. And again, retreating, remove and distance self from the stimulus or trigger. If you can't do that, then potentially focus inward. And it's kind of like, maybe you've heard, those, count to 10, right? So slow yourself down, don't engage, focus on yourself and your body. And then again, focusing on your body is evaluating that somatic response. So stop, retreat, and scan. Focusing on our breath. So if we engage in deep, regular, even breaths, and there are a couple of techniques. The first is the 4-7-8 breathing technique. And that is inhaling for 4 seconds, holding for 8 seconds, and then exhaling for 8 seconds. And research indicates that when one breathes deeply, the parasympathetic, again, this is the rest and digest part of the autonomic nervous system, is kicked in. And so there's a calming effect. There's also the diaphragmatic breathing, which is inhaling through the nose for 4 seconds and exhaling the mouth for 6 seconds. Diaphragmatic breathing is essentially breathing from your gut. Many times people breathe from the top of their chest. So in order to think about this moving forward, visualize a balloon. And so when you inhale, you want your diaphragm or your gut to expand like a balloon. And then as you breathe out, as you exhale, visualize that deflated balloon, right? And so engaging in that, again, engaging in this deep breathing, these deep breathing techniques, and I'm sure you've heard of a number of different ones, but it's rooted in science, it's evidence-based that this does stimulate the parasympathetic nervous system. Speaking of breathing, there's the concept of the alternate nostril breathing, known as pranayama. And it's practiced in yoga. It's a practice of breath regulation. And essentially it is exactly as it's titled, it's alternate nostril breathing. So the way to do this is to exhale completely, use your right thumb to close your right nostril, inhale through your left nostril, then close the left nostril with your fingers, open the right nostril, and exhale. And then, so maybe hopefully some of you are doing this now. And then you do the same thing on the other side. And this is a cycle, right? So you continue this up for 5 minutes. And again, evidence indicates that this stimulates parasympathetic activity. And, I'm going to be fully honest with you. Sometimes at night, if I'm going to bed, if I'm laying in bed and I'm thinking about things that I have to do the next day, I may feel a little anxious about those things. I actually use the alternate nostril breathing technique, and it really is helpful. And it actually makes me fall asleep. So give it a try. Our use of senses to soothe. So this makes sense with the limbic system, right? So if we consider the olfactory, auditory, and visual senses, we know that these senses are associated with dopaminergic brain areas. And dopamine is a neurotransmitter and hormone. It acts on areas of the brain that gives feelings of pleasure, satisfaction, and motivation. So, positive memories, nostalgia increases dopamine and serotonin, pleasant scents, and then interestingly, music, which maybe it's not so interesting. Maybe we all know that because I think, music really brings people together, but it also is pretty personal. And you think about listening to your favorite band or your favorite song, sometimes that really elevates one's mood and calms one down. The 5-4-3-2-1 grounding technique. I use this a lot when I work with clients. Not only is it a distraction, which it could be helpful sometimes, but it also engages with 5 of our senses. So you instruct a client to talk about 5 things that they can see in their vision, 4 things that they can touch, 3 things that they can hear, 2 things they can smell, 1 thing they can taste. And again, it's a distraction sometimes, but also it really grounds. And this is when we say grounding, it really brings people back into their body and really focuses on those senses. And again, going back to that evidence-based research, that then stimulates the parasympathetic system. Tipping the temperature. So cold water can be pretty helpful for moments of heightened emotional reactivity. One technique is to hold one's breath and put their face in a bowl of cold water, or even holding a cold pack on your eyes and cheeks for at least 30 seconds. And what stimulated is this mammalian diving reflex. And that actually is a way that, again, it helps with the parasympathetic nervous system to be activated, and it prompts a relaxation response. And this physiological change actually helps conserve energy. It slows things down. So that cold water technique can be really helpful. Sometimes I'll instruct clients when they feel dysregulated to take a cold compress and put it on the back of their neck or on their wrist or behind their knee and their joints. And that may actually help soothe themselves. Muscle relaxation. So adding muscle relaxation to paced breathing while inhaling and exhaling, tense body muscles one by one. Again, noticing your body, noticing the tension, breathing out and letting go of the tension by completely relaxing your muscles. I mean, this may be hard to do, in the middle of your workday, but if you can close your office door and lay on your floor, give it a try. And just as I had you think about an upsetting memory in the last 2 weeks, conversely, we can think about a calm place or a good memory, and that may actually stimulate the parasympathetic response. So some techniques might include visualizing a favorite vacation destination or a comfortable room in your home where you feel safe, a pleasant memory, as I said, and oftentimes a photograph or a picture might help carry it on your person. And again, this is the senses, right? We're looking at something visually. Acute aerobic exercise. So we know the benefits of exercise. We hear this time and time again, and here's another one. Acute moderate aerobic exercise facilitates that down regulation. So it allows for the regulation of your body and reduces negative emotions. And it helps, individuals who are more vulnerable to problematic affective dysregulation be less susceptible to the impact or lingering effects of a stressor. So when we say acute, I mean, this is up to the individual. So acute for me may not be acute for the person next to me. Acute may be, I'm going to take a rapid, fast-paced walk around the block. Person next to me may say, well, I'm not going to go too rapid, but I'm going to walk around the block, and that's enough for me. So it's pretty tailored to the individual. Think about moderate aerobic exercise as defined by you, but even small spurts of that may help with emotional dysregulation. And as an aside, that dopamine is released when one engages in aerobic exercise. And the nose knows. So again, the sense of smell and the olfactory system. I often encourage clients to carry essential oils with them. You can get like a small bottle I get them at TJ Maxx, or you can get them at the grocery store. Your favorite smell could be mint or lemon or something like that. Lavender is helpful. Maybe even put it on a handkerchief or a Kleenex and carry that in your pocket. So when things are becoming dysregulated, when you're feeling your body go a little haywire, you can pull that out and focus on that smell. Same with perfume, dried spice or flowers, maybe a sprig of herbs. No, I mean, we all know this, that certain autobiographical smells can have a calming effect, right? So think about autobiographical smells in general, right? Like whenever I smell Polo cologne, for example, it brings me back to circa 1986 in the hallway of my high school. And we go back to music. So classical music can be really helpful in terms of regulating, and also one's favorite music, and maybe trying to regulate your breath to the beats in your favorite music. Sounds of nature, forest or the ocean can help. Or just basic white noise has shown to improve those who struggle with dysregulation. And tactile grounding, so that sense of touch, right? One of the things that I have clients do is hold an object and play a game of 10 or 20 questions. So I'll have geodes or rocks in my office, and I will have the client palm the rock And I'll basically ask questions. What colors do you see in this geode? What's the texture of this geode? What's the weight of this geode in your hand? What's the temperature? Is it cool to the touch? So again, just this tactile grounding method that can help with dysregulation. Another is holding an ice cube in your hand until it melts. And this is actually two, right? So you can do the tactile of the feel of the cold, but it also, a couple slides back, we talked about how helpful cold water can be. All right, I wouldn't be a very good professor if I didn't give you all homework. So I would like for you all to increase awareness of your body. In the next 24 hours, monitor your physical reactions. Try a brief body scan. And when I say a body scan, I mean head to toe, right? And do this in moments like waiting at a stoplight, for example, on your way to work, or even on your way home from work, or going to the grocery store, while in a work meeting, while watching the news, or perhaps when lying in bed before you fall asleep. And then ask yourself, is there a correlation between your physical state and current stressors? So if folks are on the way to work and they've got a big presentation, or they're going to meet with their boss, is that stress creating some sort of physical response in your body? Reflect on moments of high stress within the past month. How did you react? Were there occasions in which you would have preferred to react differently? Was there emotional dysregulation in the terms of an explosiveness, so to speak? In the next week, try at least 2 sensory regulation techniques. So the tactile, or the smelling of something pleasant, listening to music while doing some regulated breathing. You don't necessarily need to wait until you feel overwhelmed or stressed. Try a proactive stance as it relates to this assignment, and see if there's any impact on your body as you move forward. All right. I am going to stop. I should also say really quickly, if I will share my email, if anyone has any questions for me after this presentation, after we're done, feel free to email me. I'm happy to respond. I will stop my screen share, and I will take a look at any questions that may have come up.
I haven't noticed any questions in the chat, Scott. I think everyone's been very focused on your presentation.
Okay. Wow. And look at that. I'm right at 6:59, but I don't want to rush anybody. So if there are questions or thoughts or comments, I'm happy to hear. You are welcome, Amanda. Thank you, Sharon. All right. I mean, this essentially, I think, Mary, I may be speaking out of turn, but I think that you all have future presentations related to body awareness and emotional well-being.
We will have some future presentations. The next one will be on trauma-sensitive yoga in May.
Okay.
And so first off, I want to thank you, Scott, for a wonderful presentation. And I'm going to do the homework. I'm thinking that the rest of the people here will too. So everyone knows, we'll keep a look at the chat in case something comes up while I wrap this up. I put Scott's email in the chat, and tomorrow I'll send you all an email with the links that were put in the chat during the presentation and the links to the slides that Scott showed. And in the next couple of days, both the recording of this event and the links will be up on our website, so you can go there and look also. And any questions you have, you can direct them straight to Scott, or other questions about what's coming up, direct them to the Empower Idaho email. I do see a question. It says, is there a next step for me to learn? Reading or trainings in Boise? That's for you, Scott.
Well, I can tell you, I mean, I think, many of these techniques are included in what we call the third wave therapies. So third wave therapies are dialectical behavioral therapy, acceptance and commitment therapy. And so you can't go wrong if you do any research related to those two specific therapy paradigms, because it's really focused on mindfulness approaches and emotional regulation. I will say one resource that I go back to that offers really great trainings is the DBT, the Portland DBT Institute. And you can just, I don't know the website offhand, but you can Google that. And they offer virtual, in-person and virtual trainings. But yeah. And again, John Kabat-Zinn, who does that mindfulness cognitive behavioral therapy. I mean, he essentially is the guru, and he has a number of books. The first book that he wrote, which I recommend, is called Wherever You Go, There You Are.
Thank you very much.
You're welcome.
Yeah, I was looking online, if I was just briefly trying to find out about some of the ways to get approved, or to learn more about the exercise, like the stretching, just those movements, that sort of thing. And it's so confusing, to try to know. I'm a peer support specialist, so then, kind of how I can add without being a therapist, but, I'm really excited to incorporate these things with my people.
Sure. Yeah, absolutely. And I think if you do a little bit of independent research on DBT,
Okay.
that would be a great thing. And actually, I'm going to plug Empower Idaho. I think the yoga training would be really helpful, because I think there'd be some techniques that lay persons can use for themselves.
Okay.
For individuals.
Okay, through Empower Idaho then?
Yeah.
Okay, super. Thank you so much.
Yeah, absolutely.
Well, Scott, once again, thank you very much. And if you look in the chat, you can sign up you can subscribe to our newsletter, and that way you will get information about all of our future trainings. We don't try to bombard you with it, but we do like to give you information in our newsletter. And
Great.
Otherwise, I just want to thank you so much once again, and everyone, thanks for joining us, and have a wonderful night.
Thank you, everyone. I appreciate your time tonight.
Good night. Thanks, Scott.
Yeah, absolutely.
It was great.
I mean, what'd you guys think?
I thought it was lovely. And thank you, Lisa, so much.
Absolutely. It was my pleasure. Thank you.
Thank you, Lisa.
I thought it was wonderful, Scott. And believe me, it made me think of, I'm going to do the homework, because I'm sure it'll be helpful. And I agree with the whole exercise thing, but I'm going to try the ice cube.
Okay, yeah, try the ice cube. Well, I'm going to share something with you. So before we started, I had a frozen bottle of water that I was holding on to because I was feeling a little nervous, right? So I actually used it myself. It calms me down a little bit. Yeah.
And I have those in my freezer because I had to use them in that thing when I had my ankle surgery. You put those frozen bottles in there instead of ice cubes to keep it cold. And anyway.
Try it, yeah.
Excellent. All right, I'm gonna sign off for all of us. Thank you, everybody, for hanging in. Everybody stayed the whole time, Scott. Excellent. It was a good thing.
Excellent. Take care, everybody. Thank you.
All right, bye-bye.